Why do people commit suicide? Can we prevent suicide? What are the warning signs? How can we help them? Close to 800,000 people die by suicide every year. Furthermore, for each suicide, there are more than 20 suicide attempts. Suicide and suicide attempts have a ripple effect that impacts families, friends, colleagues, communities, and societies. Suicide is preventable, but to prevent it, we must talk about it, and the way we talk about it matters. What drives an individual to take his or her own life? It is often difficult for us to imagine what led a friend, a family member, a celebrity to commit suicide. There may be no clear warning signs, or you may wonder what clue you might have missed. Often, many factors combine to lead an individual to the decision to take his or her own life. Suicide is a desperate attempt to escape suffering that has become unbearable. Blinded by feelings of self-loathing, hopelessness, and isolation, an individual can't see any way of finding relief except through death. But despite their desire for this pain to stop, most suicidal individuals are deeply conflicted about ending their own lives. They wish there was an alternative to suicide, but they just can't seem to find one. Why do people consider suicide? While many factors can influence an individual's decision to commit suicide, the most common one is severe depression. Other mental illnesses can also play a role in suicide. For example, a person with schizophrenia or other psychotic illnesses might be hearing voices that command them to kill themselves. Bipolar disorder is an illness wherein an individual experiences alternating periods of high and low mood. This too can contribute an increased risk of suicide. Borderline personality disorder is a condition with high suicide rate. Substance abuse disorders and PTSD, post-traumatic stress disorder, also increases the risk for suicide. While not everyone who experiences mental health issues will attempt or even consider suicide, but deep emotional pain plays a significant part in suicidal behavior and risk for suicide. Other factors can also contribute to suicide, including breakup or loss of a significant other, loss of a child or a close friend, financial distress, a serious medical condition or terminal illness, legal troubles, persistent feelings of failure or shame, adverse childhood experiences such as trauma, abuse or bullying, discrimination, racism or other challenges related to being an immigrant or belonging to a minority group, having a gender identity or sexual orientation which is not supported by friends and family. Facing more than one type of these distresses can sometimes increase suicidal risk. How can I tell if someone is thinking about suicide? It is not always possible to tell if someone is considering suicide. However, there are a number of warning signs that might suggest that suicide is on one's mind. But these signs are not present in everyone. And again, if these signs are present in someone, that doesn't necessarily mean that they're contemplating suicide. But if you know someone who is showing these signs, it is best to encourage them to talk to a therapist or a mental health professional. Even if they are not considering suicide, these signs may still suggest that something serious is going on. These signs include talking about death or violence, talking about dying or wanting to die, rapid changes in mood, accessing means or things that can help in suicide. For example, buying large amounts of certain over-the-counter or prescription medications, impulsive or reckless behavior such as reckless driving, engaging in extreme sports without safety measures, substance abuse, talking about feeling trapped, feeling hopeless, feeling worthless, or feeling as if they're burdening others, extreme anxiety or agitation, withdrawal from friends, family, and other social activities, sleeping much less or more than usual, a calm or quiet mood, especially after an agitation or emotional behavior, getting their affairs in order, saying cryptic goodbyes, posting cryptic messages and images on social media. Sometimes people attempt suicide not so much because they really want to die, but because they simply don't know how to get help. Suicide attempts are not a cry for attention, but a cry for help. It is their way of showing how much they are hurting. Unfortunately, these cries for help may sometimes prove fatal. People who make failed attempts are more likely to try again, and their further attempts are most likely to prove lethal. How can you help a suicidal person? Do everything in your power to get him or her to seek professional help. Encourage the person to meet with a therapist, help locate a treatment facility, or even take them to doctor's appointment. Follow up on treatment. If the doctor has prescribed medication, make sure that he or she takes as directed. Most often, medications and therapy take time to be effective. It requires time and persistence to find the medication and therapy that is right for a particular person. Be proactive. Those who are contemplating suicide most often believe that they cannot be helped. So, you have to be more proactive while offering assistance. Do not wait for them to call you or even expect them to return your calls. Drop by, call again, invite the person out. Encourage him or her to make positive lifestyle changes such as healthy diet, getting plenty of sleep, going out in the sun or nature for at least 30 minutes a day. Make a safety plan. Help the person develop a set of steps which he or she promises to follow during a suicidal crisis. It should also identify triggers that could lead to a suicidal crisis, such as anniversary of a loss, alcohol, stress in relationships, etc. Remove potential means of suicide, such as pills, knives, razors, pesticides. If the person is likely to overdose, lock the medications away and give them out only as the person needs. Even after the immediate suicidal crisis has passed, stay in touch with the person, periodically checking in or dropping by. Suicide is tragic and complicated, but it is preventable. Knowing the warning signs of suicide and how to get help can help save lives. Thank you.